I'm Dr. Scott Schlesinger of Legacy Spine Neurological Specialist, and we're here today at Legacy Surgery Center, specializing in minimally invasive spine care. And we have a sweet volunteer, Ms. Human today, who's volunteered to have us produce this educational video for patients regarding selective nerve root blocks, lumbar selective nerve blocks. And the purpose of this procedure is frequently a test. What we're trying to do is figure out if somebody's got 2 or 3 different nerves that could be causing nerve pain down the limb, which one is it? And so what we're doing with this procedure, as we explain in the clinic, is we're going to be temporarily putting that one nerve that we selected to test today, in your case, the L5 nerve root, by blocking it in the 5-1 foramen. We're going to be isolating it and then blocking it with the longer acting topical anesthetic, bupivacaine. And that's going to last for several hours to days, and it'll wear off. We'll put some steroids in that solution as well and maybe get some extra benefit. But the main goal is, and the very important thing for you to remember, as well as all of our patients, is that you got to keep a careful diary of how it works. Second thing is, during the procedure, it's important to know, did we stimulate the nerve? So we want to know if you got the typical leg pain when we get real close to the nerve, or did you get no leg pain, or did you get just back pain? We want to know some feedback, and then we need some feedback afterwards. So it's very important to keep a careful log and communicate back to our office, this is what I got. And not wait till a month later and say it didn't help, but forget that the first 2 weeks you had no pain. So we need to know in a time-oriented fashion how much relief you got immediately and for how long and what percent and how long it lasted. That's very important. Now that's the good side. We can help isolate and identify and guide and steer us to do the right thing in terms of surgical relief. But at the same time, there's a small chance that it could last for a long time if the steroid kicks in and helps. Now, for everything good, there's something bad potentially. When you get a new car, there's a chance you could wreck it. I mean, so for everything good, there's some chance of bad. And so what could happen? Well, there's a risk of infection, nerve injury, spinal injury, bleeding, spinal headaches, allergic reactions, anything sort of that you've thought of with epidural injections or with any sort of medication or any procedure can happen. It's fortunately very rare. Now, what is expected is some pain during the procedure, particularly when we get down by the nerve, numbness in the leg afterwards, because I'm putting a nerve to sleep. Is kind of like going to get a dentist to put an area of nerve innervation to sleep. You're going to feel numb in the leg and probably some transient weakness in the nerve's distribution. So if that nerve goes, in your case, number 5, lifts the foot up, you're probably gonna have some problem with your foot flopping for a few hours. That's why we want you to be very careful. We'll have you leave here in a wheelchair and then be careful. It wears off, 99% of the time over a few hours. But we will be localizing using this fluoroscope machine in your case, and we'll show some pictures of what this looks like, the exact nerve, and then we will put the block on it. So we're now ready to proceed if you are.
Yeah, I'm ready.
Okay, thank you.
You're welcome.
Okay, so what I've done now is clean your back and draped it and placed just a localizing needle so that I can know where to put the numbing medication. As you can see on the video screen here, we've got the needle tip right at the L5-S1 neuroforamen on the right, immediately below where the surgery was previously done. Michael, could you be so kind as to point that out, please? Right there. So that's the needle tip that we're using for localization. It is sitting, there's going to be a little bee sting now, and this is sitting right over the foramen, L5-S1. And now we're going to put the needle in, and it's through that numbed up area. And so using the image guidance, we're going to be able to, now you're going to feel a jolt of pain as this gets close to the target. Okay, I think we're very close there. I'm gonna go ahead and put a little contrast dye, and then I'm going to take another photo. Okay, I'm gonna have you go lateral now, so we're gonna take a different image of this. Hey, try to hold still for me. All right, so as you can see, and Michael will point out, I mean, we are immediately at the foramen. We're perfectly at the neural foramen, right where we want to be. So now we're going to be injecting the medication. This is the combination of the dexamethasone and bupivacaine in the right side L5S1 foramen. I need you to tell me, I'm aspirating back to make sure there's no venous blood, and then can you feel that down your leg now?
Oh, yeah.
Okay, so that's the reproduction that we were looking for of the leg pain. I'm sorry, but that just tells me we're in the right spot, and now we've gotten the medication in, and you've confirmed it is the right spot?
Yes, sir, it is.
Okay, good. And now the important thing is you keeping a careful diary and giving us feedback, okay?
I promise you I will.
All right, thank you very much.
Thank you.
Can you move your legs for me?
Yeah.
And the other one? Good, perfect. Okay, now it's gonna be a little numb.
Okay.
Thank you, and then you can see here on the video camera the needle tip right at the foramen. There's a nerve coming right out through there, and the same thing here. That's the AP and the lateral view of what the nerve block should look like.